Good afternoon, everyone. Welcome to today's session. Very excited to introduce you guys to our guest speaker, Dr. Jaclyn Tolentino. She is a board certified family physician who has built a practice around integrative and functional medicine, hormone optimization, preventative wellness, and whole person care. Her work is compelling because she doesn't just treat symptoms, she looks for root causes and helps individuals reclaim their health and vitality. We are very honored to have her here today to educate us more on breast cancer, go through her own personal journey, and then we'll have a live Q&A to answer as many questions as possible. So I will go ahead and let Dr. Jaclyn take it away.
Thank you so much. We're shifting gears a little bit because we were going to be joined with Susan, um, but things happen. So, so I'm going to start just by sharing a little bit about my personal journey, and absolutely feel free to put all of your questions in the chat because that's always good for us to go through that at the end and make sure that we're getting questions answered. One of the first things that we wanted to make sure we talked about is just how how hard this journey can be and how difficult it is. But it's always nice to kind of talk about it in community and be in a space where you're in a container to share and learn and grow from that. So thank you for joining us today. October is a bit of a reflective month for me. I think about October being on the touchier side just because it can be sensitive to see so much, but at the same time it feels empowering because as much awareness as we have out there, it helps bring out like the entire breast cancer experience in the community. So some days it just feels hard, and other days you're like, yes, thank goodness we have this incredible rock star community around us. My personal experience with breast cancer, don't know how much you all know about me, but I'm in my early 40s. I was diagnosed when I was just turning 33, 34. And this is about 9 years ago. I was walking on the beach with my husband and my dog, and my husband was tickling me, and we were just playing around after a work day. And he's the one who found the lump on me. So I didn't find it on myself. I think that's also a hard thing to realize is I was a full-blown practicing concierge doctor in Miami Beach, seeing patients every day, even on weekends and holidays. There I was just not paying attention to myself and not noticing something as simple as that, not doing my self exams and so on. So from that moment on, it just was a roller coaster because the minute that you find a mass, you immediately are going to talk to the doctor. You're going to want to do some imaging. You're going to want to make sure that what you're feeling is if there is truly something there. And then you're thinking, and the wheels are turning. And for me, my mom had breast cancer now three times. She was 48, she was 68, and now she is 83, and she's had metastatic breast cancer for a few years. And my mom and we did genetic testing. We went through all that, and there was no match. So not BRCA positive, not any of the other genetic markers positive. And yet we both went through and are going or gone through this cancer journey, and she's still going through that cancer journey, and I'm in a different part of mine. And that was hard because if I followed standard practice, I wouldn't have tested or done any traditional testing until around the age of 38. Because when you go see a doctor and they say, okay, 10 years before a first degree family relative may have had cancer, 10 years before is when you may consider starting to test. And I don't know where I would be if I had waited that long, because that would have been like 5 or 6 years after the original diagnosis. So things happen and you learn, you grow, you educate others, you share your story so that regardless of what age that you're paying attention to how you're feeling, what certain risk factors might be pertinent. And it's important for us to educate ourselves. We're now seeing so many younger women that are going through breast cancer, even in their 20s and early 30s, like myself. It's not just a disease of older men and women. It's not just 50s and 60s anymore. And strikingly, we're seeing more and more of that. And I think that's important for us to recognize is that it's not just a disease for older people. It's actually now we're seeing it younger and younger. And the more that we're aware, the more that we can focus on prevention and even catching in these earlier stages, then the better the outcomes are. One of the other questions that Susan had mentioned is what what surprises me the most about being on the other side of care? And I think what she was referring to was me as a physician. When I was going through the whole journey, I think the hardest part was I still felt alone and I still felt like I wasn't getting answers. Everybody was so focused on treatment, so focused on here's your next steps, here's the possibilities, seeing doctor after doctor and going through different kinds of imaging and getting so many other opinions, not just from doctors, but other practitioners. It was really overwhelming. And I think it's important for us as practitioners to recognize that it is an overwhelming experience, regardless of where you are in that journey. And many practitioners, like myself and even the team over at Joi, we recognize that. And we're here to offer supportive advice, to be a listening ear, and also to help with guidance in a way that feels kind and thoughtful and not demanding. And this is exactly what you have to do. 100. It's important to hear your story and understand where your curiosity lies and where your questions are. Um, when I think about like when I was diagnosed, it really shifted how I approach seeing patients because I was somebody who was seeing 20 people a day, 5 days a week. And then I was seeing patients on the weekends, seeing patients on holidays. I didn't give myself time to rest. I didn't understand fatigue as being multifactorial. And it wasn't just because I had such a high workload and I was pushing myself so hard, but it was also because I was going through this experience underneath the surface and didn't know it. I always chalked up the fatigue to something else. I'm like, oh, you're just tired. You just didn't sleep well that night. It's just the work because you're seeing so many patients. But lo and behold, right underneath the surface, there was clearly so much more going on. And they always say that, by the time you can palpate and feel a mass in the body that's large enough to even see on imaging, that has likely been growing and manifesting over the course of years. And for some of us, even 10 years before we ever get a diagnosis like that. That was important because I did a lot of reflecting, especially over the years, just thinking about how and why this happened. And I think back to a 23-year-old Jaclyn and what she was doing back then. What was my life like back then? And I was not taking good care of myself. Whether you think of this as like partying and, a poor diet and running yourself ragged and not sleeping well, or you think of this as, about to start medical school, so much stress, so much pressure. And, I think about what my life was like, even as I was going through school. I didn't take as good of care of myself as I wanted to. And now that I look back, I think that there are so many different variables, and it's never really just one reason or one cause. It's a culmination of my own personal unique experience, in addition to things that we often think about in medicine that people should be looking into. So, a post that I had put on my social a while ago was about breast cancer risk factors and things that you should talk to your doctor about. Equally as important as your symptoms, it's always important to pay attention to family history. If cancer runs in the family, you're also thinking about your period cycles, what kinds of medications that you've been on over the course of time. If you're somebody who has dense breast tissue, that's important to know as well, because that can make it more difficult to see things on different kinds of imaging. And so it's important for us to recognize that if there's any sort of family history of breast cancer and what types those are and which relatives those are in, that's important for us to know as well. If you've had breast implants, for very rare cases, that's also an important fact. And these are just things that it's almost like a checklist for you to think about for yourself and what your experience is, and then make sure that you share this information with your doctor. And then, of course, the bedrock is always not just that family and personal history, but also lifestyle. And we know that if we focus on the foundations like sleep and stress and how we move our bodies and how we nourish our bodies, Those are all really important things that help us thrive, that help our body adjust and grow and even heal when it comes to any part of where you are in the breast cancer journey. So the lifestyle factors are absolutely still at the top of the list and always will be. Next thing that we wanted to discuss is going back to this concept of how it can affect women at different ages. And most of the time, women are getting mammograms 40 and up. There are other imaging modalities. And even though many associations might not find a self-exam to be helpful, personally, I do, because I feel like it's important for you to know what's normal in your body. Um, when people do self-exams, and there are so many platforms out there that help us understand. One of that is the Fondle Project. They do have videos on that. The other one is called Know Your Lemons. They also have a really great marketing campaign around getting to know your breast health, knowing how to do a self-exam. So those are examples of two. And when you're in the shower, when you're looking at yourself in the mirror, when you're doing the exams, remember that it's not just like right directly at the breast areas because breast tissue goes all the way up to the collarbone. It goes all the way under that rib area, and then of course through the entire axillary area. So we need to make sure that we're doing self-exams that are thorough and that we're feeling everywhere. But that's important to know you're normal because some women will have breast changes at different times of their menstrual cycle, depending on how the hormones and what the rhythmic nature is there. And, how you do a self-exam at the first of the month, where you are in that menstrual cycle versus what that feels like later on. If you're somebody who experiences breast tenderness, and then talking to your doctor about those changes. And then when and if you do feel something that seems abnormal from your usual, always making sure that you're bringing that up. The earlier that we can detect breast cancer, the better outcomes. Bottom line, we have a higher survival rate if we're able to catch it in those earlier stages. And I love that even now there's just so many more treatment modalities, even for patients at every stage. My mom right now, she's got metastatic breast cancer and she is 83. And so for her, treatment looks very different than it may have looked 20, 30 years ago, even when she was first diagnosed. And so there are lots of different treatment modalities and options these days. Next thing that we wanted to talk about was hormones and hormone replacement therapy. And it's a toughie. It's a tough subject. It's tough for many reasons because many practitioners still feel as though the answer is 150% no for those women who have had breast cancer and that they can't be prescribed or even talk about the conversations around hormone replacement therapy or how to support their own hormone health. And that's unfortunate because it should still be part of the conversation so that people do understand what's going on. We know that hormones are naturally circulating throughout your body all the time. And for patients that are thinking about what role hormones play as we get older, both men and women, as we see a decline in those hormones, we think about how detrimental it can be for brain health, for bone health, and even for cardiovascular health. And even if somebody has this experience of going through breast cancer, it still should be part of the conversation of, what are the tools that are still available in my toolbox that I can still use? And for some, hormones are still part of that conversation. So in functional medicine, we always think about how hormones are metabolized in the body. And many of them, especially things like estrogen, are actually metabolized through the digestive tract, through the liver, through your gastrointestinal tract, and even the kidneys. So as we support the whole body and how your body detoxifies these hormones, it's super important. The next thing is thinking about lifestyle, nutrition, movement, sleep, stress, emotional health, all of that. It's just so valuable, not just for breast cancer world, but for everyone. And especially in the breast cancer world, there are things that we think that are extra important related to detox and metabolism and setting a really good foundation. That's the bedrock of how our body is going to be capable of resilience and doing these things. So as we as we kind of go through that experience, it's always nice to take inventory and check in with yourself whether you do this on a daily, a weekly, a monthly basis to kind of assess where you need to move the needle, where you want to make some changes to help support any aspect of lifestyle, that is always super important. I know that this is a lot of information, but we also wanted to make sure that we had things open in terms of questions, and being able, to ask. This is a container of space here for this bit of time. So I'd love to open the floor to be able to answer some questions that people may have. My practice, I work at Love Life. I'm the lead physician there. I'm a local practitioner here in the Los Angeles area. So I focus on functional integrative medicine. I have an incredible team there at Love Life, and all of our experts, we do collaborate on our care. So that's a bit more about my perspective and where I come from. All right, well, what do we got?
Let's see. We've got one question from an anonymous tender. I've seen information around mammograms. What are recommendations for those thinking through preventative efforts without
Mhm.
increasing risk or potential false positives, negatives?
Yeah, it's tricky. There are some newer mammograms these days, some that are not widely available yet. And I always tell people that we can, and if possible, if we can do more than one modality. Sometimes it's not just a mammogram because if you have dense breasts, we can miss some things. So ultrasounds still have value. For some patients, combining the mammogram and ultrasound or even doing a thermogram still has value just to give us bits of information. Normally, patients that are in their 40s, so usually 40 and up is when it's recommended. And some people will have earlier conversations with their doctor, depending on what they're feeling, what they're noticing, and they may get that sooner. Like in my case, if I wasn't going to get it at age 38, for some, it would have been reasonable to consider it at even 35 or even 30. So, bringing that up to your doctor and talking about what those possible risk factors are, what you're noticing, even if you're less than age 40, that's still an important conversation to have.
Yeah, amazing. Let's see. So from our emails and social, we've got a couple questions that came in. Let's cover Lucia. So what studies have been done on women that are ER positive, PR positive, to negative love breast cancer survivors and the use of estrogen therapy to help prevent dementia and other lack of estrogen related problems?
Yeah, that's a good question. Dr. Avram Blooming wrote a really great book, and it's called Estrogen Matters. So, for whoever asked that question, I highly recommend you take a look at that book. There is a chapter specifically that goes through breast cancer and patients who were diagnosed and were treated for breast cancer and then were then given hormone therapies after that. And it goes through like multiple years, like 2 decades of the science behind that, where 24 of 25 of the studies that had been done in cases like that had shown that there was very low, if not no risk of recurrence, and that the safety profiles were actually positive. Yet it's not talked about, and most traditional oncologists won't acknowledge that. But I do like that book because it does outline all 25 of the studies that indicate that show that. And for some, that is a book that they're bringing in as part of the conversation to be had. We know that vaginal estrogen is something that we can and still recommend even for patients who have had breast cancer. And then for some integrative oncologists and some practitioners, they're still recommending hormone therapies post-cancer in patients. Again, it's very much a unique approach. It's very much personalized, and there's lots to consider. In patients in my practice, I do like to look at how hormones are metabolized in the body. So I do look at hormone metabolism via tests like Dutch and Genova that do take a look at it via urine so I can see what the output is, because how your body metabolizes those hormones can give us some additional information. For me, learning about tests like that was important because what I saw early on in my breast cancer journey is that I did not metabolize hormones well. My gut was a mess. The ecosystem of the bacteria there was not good. I was recirculating a lot of estrogen throughout my body, which created an inflammatory state and contributed to abnormal cells. And so there are companies that offer some additional testing like that. And for some, it could be really helpful. So even in my practice, I changed my protocols. And then, of course, for myself, I kind of learned a lot about that. And that was kind of at a delicate time. I was going through chemo. I lost all my hair, but I wanted to make sure that I learned more about hormones and what role that played in my body. Some another bit of information, Kate, that I didn't bring up is that I'm also a mom to a toddler. So
Mhm.
I'm 43 and I have a 14 months old son that I carried myself for that pregnancy. And you have to always think, okay, when we go through things like pregnancy, there are hormones that are also circulating throughout your body for that entire 9 to 10 months. And so like the fear that we have around hormones, especially bioidentical hormone replacement therapy, I think it's unwarranted and it's worthy of a conversation for you to have with your practitioner just to talk about whether or not you're somebody who could or consider that. Mhm.
Yeah, okay. We've got another question in the chat from Asin. She wanted to know if there are any common myths around breast cancer, and maybe we can debunk some of those.
Yeah, that's a good question. I mean, one of the ones that people always ask is it true that only women who have a family history are the ones at risk? And that's not true because the reality is that around 85% of women who are diagnosed with breast cancer do not actually have a family history of it. We don't have a first degree relative or anybody down, the ancestral bloodline who's had it. So that's one that's a very common myth. Another is if you're eating really healthy and you have like really great exercise and your lifestyle and all of that is dialed in, that you can't get breast cancer. And we also know that that is not true. I mentioned earlier on, we're seeing so many patients who are younger and younger, and maybe they weren't like me, and that they do have things dialed in like lifestyle and diet. And this is why it's important to talk to your doctor about your own family history and what possible risk factors could play in what your experience is like. And then another myth that I think is a really important one is that once your treatment ends, you're done, your healing is complete, and it's not something to worry about or think about again. And for those of us who've experienced it, that's just not what happens. I remember when my oncologist said, "All right, your treatment's done. You've gone through hormone suppressive medications, put in a chemically induced menopause. I had a double mastectomy. I went through chemo. I had all the things." And then it was like, now you can go back to living your life. And I'm like, what do you mean? Like it's not just that the treatment and that part of the journey may have ended, but I felt like that was like the beginning of so much more. I wanted to learn about my body. I wanted to take good care of it as much as possible. I wanted to heal. I wanted to process that traumatic experience and understand it. So I also think that that's a myth. It's not just, oh, okay, you're done with treatment and then you're completely done and you're all healed. It's very much a journey that's unique to each one of us that has this experience. Hopefully that was helpful.
Yeah, oh, that was great. Someone else is also asking about, so HRT is such a hot topic right now. Are there
Yeah.
any benefits for women in her mid 60s, or does it increase breast cancer risk?
Yeah, yeah. So I actually get a lot of patients that ask that question, breast cancer aside. And a patient that I saw literally walked in and said, I was a victim of being one of the women who was miseducated and misinformed over the years regarding hormone replacement therapy. And we know that the myths that were propelled and the miseducation was propelled over a couple of decades. That's a long time. So there's a lot of women that are in their 50s and 60s and 70s who weren't given the right advice. And those are the women that I'm starting to see in practice that are like, hey, I'm here because I want to learn more and I want to understand if this applies to me. My answer is, whoever asked that, my answer is yes, that there is still a benefit. Now, in terms of if you uniquely have any specific risk factors or contraindications, that's where, you'll talk to the doctor, you'll talk to your doctor about that. But Do I get women in their 60s and 70s who want to support bone health and brain health and cardiovascular health even at that age? I think that from a hormone replacement standpoint, we shouldn't think that just because women are at that age that they can no longer benefit from hormones. They absolutely still can.
Okay, great. Yeah. Another good question that just came in. Are there biomarkers or labs that could monitor regular detection of breast cancer early on?
Yeah. There, these are good ones. There's there's a few tests that we look at that are cancer antigen markers, and most doctors aren't testing them. And they're usually used in the oncology world if somebody was already diagnosed and they want to see if those markers are staying stable or rise up for risk of recurrence. That's the most common that I see. But what I learned is that there are subtleties in inflammation in your body that you can actually see with other types of lab markers. Whether you're looking at a regular complete blood count or looking at markers of inflammation, in the world of integrative oncology, there are other markers that can be looked at that are inflammatory markers because we think of this as, also an inflammatory state. And so there are other ways to look at it just with blood. There are other companies that have tests that are looking at circulating tumor cells. And there's a lot of them out there. There is no perfect test. The sensitivity and the specificity of these tests, they need to be transparent and they need to show what they're capable of testing and what the risks and benefits are of testing. And once you do get that information, but there isn't a perfect test. For those that have had cancer, some oncologists will do tests like a residual tumor scan, right? RTC testing. It's blood testing, and they're typically matching to a sample that's taken from the original tumor. Even if it's like, 5, 10, 15 years ago, they're still able to take a look at that. So they do keep, they do keep that tissue mass at the hospital or wherever it is that the cancer was diagnosed, and they're able to take a look at it. But cancers are getting smarter. And, it's not just about prior tissue and prior samples. Like, sometimes these things are changing and growing and morphing and becoming other things. So there isn't a perfect test, but there are many tests that are available that can give us, more information. Bottom line.
Mm-hmm.
Yeah.
Oh, okay, great. Another one just came in from Elizabeth.
Mhm.
As a follow-up to starting hormone replacement at 64, I asked my gyno and was told I was too old to see a benefit and that she would want me off them by 70. I don't have an HO breast cancer and don't take other meds.
Yeah. I know this was a webinar for personal advice, so I'll answer it generally and say
Hmm.
that if I came across a woman who was told that by their gynecologist, look for another doctor who's just going to give you a bit of a different perspective and an understanding because there isn't a cutoff. There isn't a cutoff that says once you have a 70th birthday that you can no longer be on your hormones. That's not true. Uh, I mentioned this at an event recently, and people were really surprised. But the oldest patient that I ever had on hormone replacement was, transitioned at the age of 103 and started
Yeah.
hormones later on in life. But I think that kind of goes back to that one-on-one conversation you're having with a doctor who understands, like, if the benefits continue to outweigh risks, like, what does this look like in you? And for some, we have to also think about how nuanced it is. There's different delivery methods. It's not just about like taking oral pills or taking a topical or an injectable. There's lots of different ways. There's ways to take a look at what these levels are doing. There's ways to look at how these hormones are getting metabolized. And yeah, so it's a bit more nuanced than that. But any doctor who's going to say, oh, there is an absolute cutoff age for all patients to be off hormone replacement, that isn't true. And we are seeing that kind of goes back to the myths, right? So that's another one of those myths.
Mm-hmm. See. Maybe this last one that just came in, any strategies for long-term cancer prevention?
It's all the foundational things that we know apply to health span, apply to breast cancer, apply to all
Mhm.
different kinds of cancers. So how well we sleep night after night, that makes an impact. Thinking about how we're moving our bodies and keeping blood flowing and circulating and supporting lean muscle mass, that makes an impact. How we nourish our bodies, what kind of food we're putting in, also makes an impact. And stress is a huge one. So I always think about what impact stress plays and where we can focus more on self-care. Don't forget about community and, leaning on friends and family in your community and talking about what your experience is, because I think that can also be helpful for many people. But the bedrocks and the foundation of lifestyle will always apply, especially to the breast cancer community or cancer community in general.
Mm-hmm.
Yeah.
I see another question over here about the mixed messaging about self-examination. What's your perspective on that?
Yeah. I mentioned it a little earlier, but I think self-exams do have a place. Because if you want to know what your body naturally feels like and how your breasts might even change at different parts of your menstrual cycle, start paying attention and start doing your own self-exams. So I think that it does have a place. It's not recommended in some of the main organizations, but intuitively, it makes sense to want to know what your body looks and feels like. And so I think that's important. And we know that for women at different stages of the menstrual cycle, breasts are also changing. And even when you're going through PMS, sometimes there's breast tenderness, sometimes it's bilateral, sometimes it's one. I mean, breasts are changing. So knowing what feels normal to you and what is all of a sudden I have a lump out of nowhere or a mass that wasn't there before and it's not going away. It's not, you know, those are things to make sure that you're bringing up to your doctor that you're noticing something that is different from that normal. And I still find self-exams to be valuable because if I think even about myself and I think about what happened with me and Charles and our dog on the beach, that wasn't even me finding it, right? That was Charles doing an exam on me. And otherwise, at my annual physical, that may not have been felt, right? That may not have been found. And then, when it comes to testing, I wouldn't have been tested until a later age. So do your self exams if intuitively it feels important that you know what's normal for your body. And if you do find something that seems odd or strange, or you didn't notice that before, bring it up to your doctor.
Yeah, great.
Yeah.
And when would you say like the best time is to like try to examine yourself?
Yeah, yeah. I mean, there's lots of changes in our bodies at different stages. Like if you think about puberty, think about, what happens in our 20s and 30s, 40s and on. So any age is a good age for us to start learning about this and like what feels normal to you as your body is changing. I've even mentioned this to my niece, late teens, like still important for you to look in the mirror, to put your arms up and down, to look things from the side and pay attention and know what that feels like. Yeah.
Mm-hmm. Yeah. Let's see. Crystal asked, can you take oral contraceptives while on HRT?
Yeah, so there are some I'll sometimes see that, but it's a bit, a bit nuanced. So if you think about it, oral contraceptives are in place to kind of shut down some of those natural hormone production and what that looks like. Most of the time when women are considering HRT, I'm seeing this in patients who are in their 40s and 50s. And if they were on some sort of oral contraceptive, usually it's sunsetting that experience and then starting on an HRT experience.
Mm-hmm. So, with there being such a big fear for women around hormone therapy, can you talk a little bit more of like where that fear came from and where we are now?
Yeah, I wrote an article in The Good Trade on this one. We can link it. It was
Yeah.
hormone replacement therapy. And what happened was, just long story short, because people have written novels and books about this particular topic, including Avron Blooming in his book Estrogen Matters. He talks about this as well. But in 2003, there was a huge study that was done on hormones, and it was done on a different population. And then they applied that information to another different population. And some of the advice that came from that is that hormones were dangerous and women needed to stop it. Media took that by storm, and it kind of became a whole thing where the medical community and the greater community at large for the next 2 decades beyond that just shut down any sort of hormone replacement therapy because of what the studies, this particular study and what the findings were. And this propelled for 2 decades, which is why there are so many women that are in their 50s and 60s where they were given that old advice. They were given the advice that hormones are dangerous, that they shouldn't be on it, that they, shouldn't even talk about it, that it shouldn't be part of their toolbox in their journeys in perimenopause and menopause. We are now seeing shift. There is a paradigm shift in the hormone community because more and more practitioners are educating and saying, look, there was a few positive, helpful findings from that study, but look at the population that it was tested on. And how are we applying that to yet a younger or different demographic? And so there are some nuances there. I talk about it in the article. If you want to link that, you can find it there. It's just like, a baseline surface level education, because I think it's important for us to know that there has been a huge shift in the education, and it's not the fear-based type of education that has kind of propelled for the last 2 decades. More and more practitioners are now in favor of hormone replacement therapy and all of the benefits. Yeah, and so we do talk about that extensively, but I did write an article specifically on that in case that interests you all.
Yes, yeah, just linked it in the chat. Great. Yeah, good article from the Good Trade, definitely. Um, let's see. Any other questions you guys want to
Mm.
ask?
I see one from Austin. Physical signs of breast cancers besides a lump. Interestingly, for me, the lump is what Charles found on me, right? Like he's the one who found that. I was very much fatigued,
Hmm.
tired all the time, and I just chalked it up to the workload. I chalked it up to, oh, you're a doctor, you're, seeing all these patients, you're working so hard, and that's what it is. Um, you know, in my mind, fatigue was just a part of the day to day. And I just pay close enough attention to say, could this be something deeper? Is there something else going on? Quick story. I remember I was working out with a trainer, and it was like one of my, again, early 30s. I had hired a trainer, wanted to work out, and the trainer had put me through a very basic routine, training routine, and I couldn't make it tr through the training routine because I was just so tired. And I remember this is about a month before diagnosis. And I remember the trainer being like, this is really strange. You take one look at this person, they should be able to do these basic moves, these basic things in training. And I wasn't able to do it. And I was so exhausted afterwards. So I think that was also just another clue. Like, body was screaming, body was like, hey, there's something else going on here. There's more that we need to pay attention to. Um, and so fatigue was a big one for me. When I did additional testing to look at my gut microbiome, like I mentioned, my gut was a wreck. So I needed to heal and support that. And interestingly enough, I wasn't somebody who had bloating and gas and pain and burping. I had zero gut symptoms. But know about the gut is that your immune system and several aspects of immune signaling are coming from your digestive tract, are coming from the ecosystem bacteria there through the immune intestinal lining. And no surprise that, after I had gone through all the things in my earlier treatment, that my gut wasn't in a good place. So I needed to put the proper inputs and make sure that I was feeding my the right way. So I did do gut healing protocols, and I did change and modify the diet. And then I was reflecting back on those past 10 years. What was that diet like leading up to the diagnosis? And it was very different. So,
Mhm.
yeah.
Okay. Let's see. Anyone else have any other questions?
Somebody asked about a functional medicine approach to breast cancer.
Mm.
And like, what exactly does that look like? And there are so many thought leaders in the space who talk about that specifically. Like, what does that holistic experience look like? And what are some things that we should think about addressing or assessing? Um, this is an example of a short list, so I put it in the chat, but it's just an organized framework of all the things that I think about when I'm thinking about, what a functional approach looks like. And it's a long list, right? And that's why when I say like it can be an overwhelming experience, that's why it's important to feel like you have a care team to kind of help you and guide you one step at a time to walk through this. And there are different ways to assess different aspects of this. And it's not just rooted in traditional medicine. There's different kinds of healers, different kinds of practitioners, Eastern medicine practitioners alike that I learned from to understand what role everything really truly plays in somebody who has this experience. So I hope this is just like a helpful list. I put that in the chat in case that was helpful. Somebody had that question earlier on.
Hmm.
Yeah.
Amazing.
Man, Kate, time flies. I'm like
I
11:50.
know. I
What happened?
believe we've covered everyone's questions unless there's
Yeah.
any other lingering ones that come in. Um, but if not, I mean, this was such an amazing conversation with you, Dr. Jaclyn.
Thank you.
Um, it was so great to talk to you and, take
Yeah.
up your time and learn more of your expertise and your insights. Um,
You're welcome. There's if anybody wants to, I don't know if there's any breast cancer warriors and thrivers in
yeah.
this space or whoever's listening in, but we do have a survivor community, really a thriver community,
Mm.
that'll be on Monday. So, I'm a board member for the Fondle Project, a nonprofit dedicated to early education for breast cancer. And it's free, completely free to anybody who wants to join. So spread the word if you come across somebody who's going through whatever stage in their breast cancer experience, whatever part of that journey, they can always sign up. It's free, but it's on my social as well. So it's just a space for about an hour for us to talk and sit and chat together. You can join anonymously, you can just listen in, but it'll be a nice safe space for us to just be in community together. So you're welcome to attend.
Yeah, awesome. We'll definitely include that in our follow-up email, as well as a YouTube link to this recording and some key takeaways and all the resources that we've linked in the chat throughout the ch so yeah, feel free to share everything with a friend and a family member from that email. Um, and yeah, on behalf of our team, thank you again for spending your time with us today. We look forward to staying connected and hope to see you guys at a next webinar event with us.
Thank you.
All right, thank you, everybody.
Bye.